Hello everyone, today, Dr. Demchenko is with you, a sports doctor, and we will talk to you again about the knee joint and the pain in it. Moreover, we will not talk about all types of pain in the knee joint, but only about those in which it hurts you to either bend or unbend the knee, well, or squat and get up from the squat. The fact is that sometimes such pains are associated with the fact that the bones in the knee are slightly wrong. If you take the knee, then the articulation between the femur and tibia can be either slightly to the right, or slightly to the left, or slightly with a slight turn. In fact, these are very small turns, but they can already give a very unpleasant feeling in the knee. Moreover, characteristically, they do not pass either from taking painkillers or from physiotherapy, and can torment a person for a very, very long time until he accidentally somehow shakes off his knee very successfully and suddenly everything will pass. You know, there are such stories. It hurt. It hurt. It hurt. I fell a second time and everything stopped hurting. Usually, in order to check whether this story is related to the movement of the bones, and you can immediately heal yourself, you can try to combine the bones into a more correct position yourself. To do this, we put the knee in a slight flexion and first check the flexion, extension. It is very important to catch the pain at some point in the movement. After we have caught the pain at this moment, we place our hands with the edge of the palm above and below the knee joint, on the femur and tibia. In this way. In this way. In this way. And now it is very important to exert a squeezing action strictly perpendicular to the bones. After we have pressed about 3 to 4 kilograms of force, you repeat this movement. If we hit and matched the bones correctly, then the pain should immediately disappear. If the pain has disappeared, then repeat these movements 10 times 3 sets. Sometimes you need to do it again in a day and the pain will completely go away. If nothing worked out, then try changing hands. One hand will now be outside below the knee, one inside above the knee, pressed again and tried again. This position can also help. If we have not achieved any positive or negative effect again, then you can try rotations. To do this, we put the sock a little inside, and turn the hip so that the knee looks straight, but there was a slight rotation inside. After that, we move smoothly again. That is, not to the toe, but smoothly. This movement can also remove knee pain if the problem was related to bone rotation. You can also try the reverse movement. Put the foot 15 to 20 degrees outwards. The hip is flat. If it is difficult to keep the hip straight, then you can help yourself with your hands and do a little forward. If it removes the pain, then repeat these actions. I'm going to show you once again the installation of hands on our skeleton in order to make it clearer to you where we put our hands. Once again, the first position. The installation of the hands. We try to move the bones to the side. The second position, the opposite installation of the hands. The third position, the foot inside, the femur is straight. And the fourth position, which may help, the foot out. The hip can be held. You make straight movements. This is a safe procedure. You definitely won't do worse, but in 30% of cases it can very well relieve pain and help you with the knee joint. I hope you were interested. Thank you very much for visiting our channel. Put likes. Wait for a new show. Bye everyone.